All right, let's go on with our second video on HIV disease. HIV classifications. The adult with HIV infection can transmit the virus to others at all stages of the disease. This is from page 339. This is no longer true. It's all about viral load. Viral load is the amount of virus present in the blood and other body fluids. Please read the CDC fact sheet, Evidence of HIV Treatment and Viral Suppression in Preventing the Sexual Transmission of HIV. And as you can see, we've listed that here on your for you to look at. Okay, the CDC website's right there. But it's all about viral load. The viral load is the amount of virus present in the blood and other body fluids, and that's what makes the determination on whether or not the patient can infect others. HIV classifications. Stage 0. This is after their first positive HIV test within 6 months of a last negative test. Stage 1 is the acute HIV infection. These patients usually have a large viral load. The CD4 T cell count is greater than 500 cells per millimeter cubed. There is no AIDS-defining conditions. Stage 2 is chronic HIV infection, also called asymptomatic HIV or clinical latency. HIV is still active, but their viral load increases at a very low rate. So they still have active HIV disease, but the viral load is increasing very slowly. The CD4 T cell count is usually between 200 and 490 cells per millimeter cubed, and they have no AIDS-defining conditions. Even without HIV medications, this period can last for decades or longer. Again, this is stage 2. This is that chronic HIV infection. This is not the person who is on suppressive therapy and has suppressed it. This is the person who is asymptomatic with their HIV diagnosis. They have clinical latency. The HIV is still active, but the viral load increases at a very low rate. CD4 and T cell counts are between 200 and 499 cells per millimeters cubed. There's no AIDS-defining conditions. Even without HIV medication at this period, they may last a decade or longer before they see active disease. HIV classification stage 3 is acquired immune deficiency syndrome, or AIDS. Without treatment, people with AIDS typically survive about 3 years. Now that's without treatment. Viral load is very high and very infectious. The CD4 plus T cell count is less than 200 cells per millimeter squared. Or they have an AIDS-defining condition. So their T cell count may be a little higher. It may be between 200 and 499, but then they also have an AIDS-defining condition. And you can look at those AIDS-defining conditions on table 19-1, which is the different sarcomas and things that you generally only see with the AIDS patient. And that again is on table 19-1, page 340. So if they have an AIDS-defining condition, but their CD4 plus T cell count is higher than that 200 cells per millimeter cubed, then they can still be considered to have HIV because they have an HIV-defining condition. On the other hand, if their CD4 count is low, even if they do not have the AIDS-defining condition, they are considered to have AIDS because their CD4 plus T cell count is so low. Assessment of the patient with HIV. You want to make sure that you do a complete history. You want to know when they were diagnosed, what treatment are they on, what sexual practices do they practice in, are they having safe sex, have they informed their sexual partners, You want to make sure that you are aware of what medications they're on. Are they consistent with taking their medications? These were all questions you would ask during the history gathering phase of the assessment with a patient with HIV. Care of the patient with HIV. Antiretroviral therapy only inhibits viral replication. It does not kill the virus. Monotherapy is the treatment with only one antiviral. This is not used because it promotes drug resistance and does not improve the lifespan of the patient. Again, monotherapy is not used. It used to be back late 80s, early 90s, there was only monotherapy. But now they have combination antiretroviral therapy or CART therapy. This reduces the viral load. It improves CD4 T cell counts, and it slows the progression of the disease. Prevention of drug resistance to CART is you must educate the patients not to miss their doses and to take them at the correct time. The goal is 90% of their medications are taken at the correct time and the correct dosage. Please see the nursing safety priority on page 351. On page 351, you see the nursing safety priority is to ensure that CART drugs are not missed, delayed, or administered in lower than prescribed doses. So make sure the patient isn't trying to save money by not taking their medication at their full strength. Teach the patients the importance of taking their CART drugs exactly as prescribed to maintain their effectiveness. Even a few missed doses per month can promote drug resistance. And remember the 90% rule, that you're trying to make them 90% of the time at the correct time and the correct dosage. When we're caring for the patient with reduced immunity, on chart 19-5, it talks about things you would do even for anyone who has impaired immunity. You want to make sure that you put them in a private room, that you're using good hand hygiene, that you limit the number of personnel that enter the room. You wouldn't want to give them a patient or a nurse who even had just a little bit of a cold. You want to make sure that you're doing mouth care, that you're making sure that you keep fresh flowers and potted plants out of the patient's room. You want to teach the patient to eat low bacterial diets, avoiding raw fruits and vegetables, undercooked meats and eggs. You want to make sure that we're limiting their visitors to only healthy people. You want to make sure that you're not letting other people in who are immunosuppressed or that have opportunistic infections. Other ways that we care for patients with AIDS in infectious prevention is when we're dealing with our patient and their family, and patient family education for going home. Basically, you talk about avoiding crowds, and of course you don't want to have them share personal care items so that they're not infecting others with their HIV. If possible, they need to bathe daily using an antimicrobial soap. If total bathing is not possible, wash their armpits, groin, and genitals an area twice a day with an antibacterial soap to avoid fungal infections. You want to make sure that they're getting a clean toothbrush at least once a week. You want to wash their hands thoroughly. You want to avoid eating those raw vegetables, including salads. You want to make sure that you're washing their dishes. And you want to make sure that you're not drinking liquids that have been standing for longer than 1 hour. And not to reuse cups or glasses without washing them. These are all things that you can do to prevent infections with others, so that you don't end up giving the HIV to other people within your home. Along with that, it also helps to keep the patient from getting opportunistic infections. So this list on chart 19-4 kind of does both. It talks about ways to prevent giving others the HIV infection, but also ways to prevent the patient from getting opportunistic infections. the chart 19-8 on page, hang on, it's on here somewhere. Oopsie doodle. Now the chart 19-8 talks specifically about ways for infection control for home care for the patient with AIDS, and this is all about making sure that you're not that they're not giving the HIV infection to loved ones who are caring for them at home. Sorry.